rest. Nice.
I didn't even know you could reach that.
It's like,
It feels so good.
I feel ya. It's like I didn't know
I'm
that
like,
could even get worked on.
Yeah.
Hey everybody, this is Dr. Ward here at Chiropractic in Towson, Baltimore, Maryland. I'm with Rachel today. This is our second appointment, Rachel. So I've never done a second appointment kind of video before, but it's a nice one because we get to catch up a little bit on your very first visit with me. And relatively speaking, get to catch up on how it went, how you're feeling. It's early on. Like I kind of equate a lot of body manual work to going to the gym. Or like getting into like a workout routine. You don't go to the gym and you're like, I lifted my biceps, I'm good for life, I'm good. Now sometimes when people are coming to see me with a problem, not always, but sometimes it's like a little bit of work in progress, if you will. And I kind of categorize it into different areas, if you will, when we work with people. We as a team do this. We focus on feeling better faster. That's the pain portion of care. That's what we call it. And so a lot of the times that's what brings people to see me. Rachel, your neck was bothering you.
Yes.
You're having headaches, upper back discomfort. You're like, oh man, I need to get back in my routine, because she had good experience in the past with chiropractic.
It's about 3 years ago.
A while ago, right?
Yeah.
Yeah, it's, and like from your perspective, it's been 3 years since you had a good rhythm of things as relates to that.
Yes.
Life, right? And then you're back, and I love what she does for a living. She works with kids with special needs, and you're on the floor, you're playing, you're interacting with them a lot of times. It's a very physical job, I'd imagine.
It is.
And so that's been happening since you've gotten back here, right?
Yes.
And then what happened next? What kind of was just like, what was the domino effect to have you come here?
I think that just having the pain on and off and moving to a new city, I wanted to go back into a routine of getting healthy again, and so I wanted to come back. I know I kind of missed the relief it brought.
Yeah, I'm biased, but I love that Rachel's approach was like, I'm getting my team together, right? Like I've got my rhythm back, and then I know what helps me, and I want to maintain good health. And my neck's starting to bark at me a little bit. I gotta find my chiro or my body guy in the area, body woman in the area, right? And so you've had good experience with chiropractic care in the past. That's one aspect of what we do here. And so you came in to see us, right?
Yes.
All right. So 2 days ago was your first appointment.
Yeah.
All right, candid. Let's hope it went well.
Yeah,
How
it did.
are you feeling?
Really good. I really it did help loosen me up a little bit.
Good.
I love the dry needling that you do as well.
Nice.
That always helps. It feels like it breaks up that tension, so I get that relief from that. I do have a little bit of pain from like right under here, under that shoulder blade. Kind of from last time, I think.
Yeah.
But other than that, I felt, pretty relaxed.
Everything was really good, but there's some soreness that's like kind of like, oh, that's new. I need to work on that. Then thank you for telling me.
Yeah.
And I'll work that out for you. I promise.
Awesome.
Okay.
Yeah.
And so, do you mind if I share some of the initial complaints and just kind of your the diagnosis, if you will? Is that okay?
Yeah,
with you?
feel free.
Thank you. So relative to that, the first thing, we print out a report and we go over this with you on your second visit, and that's what we're doing now. So relative to that report, there's a couple components to it. This is kind of, we call this your recovery plan, or what we want to focus on, okay? So there's the functional component of what we have here, and then this is the actual area that's irritated. So your cervical joint restriction, or cervical segmental, that just means one of the segments, is restricted or irritated, okay? The functional component of it is like what creates that type of problem is oftentimes it's repetitive stress patterns, and to categorize that, it's upper cross syndrome. So where your upper traps and your pecs are tighter is a really simple way of looking at it functionally, and then where your deep neck flexors and your lower traps, your mid back, are not engaged as well. So you have this imbalance of over tight and weak, right? And so that creates like the visual cross if you look at it from the side of the body. So tight, technically not as active, or we'll call it for lesser words, weak, and mid back weak. Okay, and so when we're kind of always working from here, if you will, or we're getting stressed in those areas, it can create neck pain from joint restriction, like what you have going on. That's why we're adjusting you.
Yeah, it sounds about right.
Yeah, it's like, that makes sense to me.
It does.
But it's important to understand that this is something that you can totally get control of and work towards improving, and I'm a catalyst for that improvement, okay? Ideally. So your treatment plan is twice a week for 4 weeks. I'll reevaluate you after a month of care, okay? Your goals for care are to decrease your overall pain, improve mobility, range of motion, and then get back to work without the discomfort and pain. We talked a little bit about physical exercise and getting into a healthy rhythm of walking and other exercises that you enjoy, but right now you're just looking for relief.
Yes.
Does that sound about right?
Yep, that sounds right.
You don't get severe headaches and migraines, but you do get them periodically.
Yeah.
You don't get them often, but you do get them like once a month is what you were saying now is the case.
Mm-hmm.
And we talked a lot about kind of the neurology of a headache and migraine and all the factors, literally systems, different parts of our body and life that goes into getting them, right? And so we always kind of look big picture, and I focus my energy in here with you on your neck and upper back, right? And then I give you ammo or information like, hey, this is how you can better equip yourself of handling them in the future, right? Managing stress, nutritional components, sleep, a lot of different levels, if you will, stimulus in the eyes, those kind of things, with screens, they all play a role in it. So that was another component of your diagnosis, or what we're going to work on. What has some room for improvement, as I like to spin it, if you will. Alrighty. So we went through those. There's a good different definition of migraine. We talked about the difference between migraine and tension headache, and this does a good job of just explaining that for you. It's important to realize those differences because once you know what it is, you can understand better what causes it. And when you understand that, you can change.
Okay.
Right? And so we'll go over those more and more. Okay, what we're doing with you to help you out. You heard I'm talking a lot. I'm sorry, you're like, come on, that shoulder spot right now, you gonna work on that? You gonna be talking while you work on me? I got you.
No worries.
Well, I appreciate that. So we're doing some myofascial release, some adjustments. We're doing dry needling. We've got therapeutic exercises and stretches. She started those last time, actually. She did a good amount of work done last time she was here. And then we talked about, there's some information here on workstation, how to position yourself at work, like really simple things, and that comes down to like limiting the things that aggravate you. And all of this basically describes that to a lesser extent. Staying hydrated, pillow selection, aerobic exercises, which can be really good, and then dietary triggers for migraines, looking at things like that that can lead to it. And you know, like we might not think about it, but caffeine can be a trigger, right? And there's some other ones here that are really common for some of the components they have from a nutrient standpoint. Like I didn't know that garlic was one. And then finally, lifestyle and environmental triggers for migraines as well, which I love. I love Chiro for this. They do a great job of patient education. So on here is a rundown. I try to be as transparent as possible, and I think that's actually, you're supposed to be as transparent as possible, but not everyone does it, as it relates to the cost of care, right? Like what does it cost, what's covered, all those things. And for your insurance, all your information is right here for you, and that's going to be what you owe per visit, okay? She just has a copay. I don't need to share any more than that. But that's just her copay. Everything that we're doing in the office that we are doing right now, it goes towards that copay. Okay? And then that's different than a deductible. These are all the modalities and services that we offer in the office. If you're like, hey, what is dry needling doing again, and what's the point of it? This does a nice job of explaining it. Or, and if you have any questions about any of the things on here, like shockwave, about nutrition, we have a strength program in the office, we have a massage therapist. There's a lot of different components. And we will soon have primary care and integrative medicine with regenerative medicine starting this summer. Shared that, Carly. We should do these videos more often. That's happening. I'm so excited for Caroline to join us. So this is yours to take, okay?
Thank you.
Most importantly, do you have any questions about any of that?
No, I don't think so.
Okay.
Sounds good.
I'll focus on the areas where you have that pain, right, that we talked about. The upper cross stuff and the functional components of it. That's where the stretches, that's where the PT that we're going to be doing with you comes into play.
Okay.
And I really believe that if you follow this plan, we'll have really good results with you. And ideally, the experience coming in here is great. You'll be met with great people. Okay?
Sounds good.
Awesome. Let's go ahead and have you stand on up. And we will do some easy soft tissue work on the hands and neck. Shoulders, all of it, okay? So you can, if you're comfortable, take your glasses off. If you want them on, you can keep them on.
That's okay.
Awesome. And then rest right on the back. With your shoulder where you're like, it's a little sore in there.
Yeah.
There?
Right there, basically.
Oh.
Yeah.
Okay, you rest your. And then you rest your hands right underneath your sternum. There you go. All right, how did you find your way into the world of working where you work? What kind of got you involved with that?
So when I was younger, I always wanted to be a teacher.
Yeah.
And in high school, I volunteered in a preschool special education class and just really loved the population. So I decided I wanted to work with kids with special needs.
Nice.
And I went to college for special education, and I was a teacher in a special ed classroom for 6 years. And then I decided to go the private route and do ABA therapy.
Which ABA therapy, she was telling me a lot about that. So if you're someone that works in that world, what a nice way of like kind of changing things up and transitioning to a different service, and a very much needed service as it relates to helping, it sounds like, really address the root problems and provide support while doing a good functional assessment. Does that sound about right?
That is, yeah.
Cool. But this is your time, so let's not let my curiosity about your work, your profession, your past life get in the way of getting you some relief in here. Let's just focus on taking care of you, alright?
Sounds good.
So you rest. I'm going to talk out a little bit what I'm doing.
No.
Other than that, you're good, you chill. So doing some, just some traction with my hands on the base of her skull and that upper neck area. Where she was like, yeah, right there, like 2 days ago when I was working with her. And that was at the base of her neck, base of her skull on the right side of her neck, that upper cervical spine. Be tight, a lot of pressure can exist up there. So I'm going to do some myofascial release, some ART in that area. Turn your head to your left. There you go. Keep relaxing. ART on the suboccipitals, and I'm going to go down a little lower. Then I'm going to work on the upper trap into the shoulder blade. I'm going to work down because her neck is just letting go perfectly. She's moving really well. And then let your jaw relax. So a lot of times cervical spine associated with the jaw. I'm going to work on the right side of this jaw a little bit. Gently open TMJs. A lot of times I have TMJ. People say to me, which is a fair statement, but a lot of times people clench.
I know I do at night. I do a lot of like grinding at night, so I wear a guard.
Yeah. We're less, able to inhibit that reflex at night when we're trying to rest, especially. We're practicing it throughout the day. You just don't realize it. Right? And so a very common approach, and I'll speak to this, what's the goal, right? Is to eliminate clenching, right? The goal of the guard is to eliminate damage to the teeth, okay? It is going to do the opposite to clenching over time, relative to you holding something in your mouth for 10 hours of sleeping. So it's not a bad thing that you're wearing it, but more often than not, I find that doesn't contribute to solving the original problem, right? And sometimes the original problem is kind of a hard thing to nail down, if you will. And that's okay. It's just still, just be mindful of the actions and the steps you're taking. So there's ways of kind of working on your jaw and your neck before you go to bed and not wearing that ideally. where you can really stop that reflex and then getting to the root problems even more. So sometimes it's purely just like a neck thing as it relates to why people are clenching. More often than not, there's layers to it, right? We're busy.
Yeah.
A lot of transition, especially early on in your 20s and 30s, school, and then work, right? And then all the good things that happen in between. So that plays a role in it for sure. Gently open and all the way forward. We're going to stay focused on the neck. We can dive in. I can talk to you some. We can do a TMJ video. Carly, I'd be happy to do that. I really like showing people how to stretch this out, how to move it side to side, how to work on the joint itself, how to do some self-massage work in this general area, even internally on the pterygoid. It's a really easy way of doing it. And then how to create stretches that do this. It'll feel like this for you. I'll show you. So it goes here and here, and then you pull. You feel that pressure you get right there?
Yeah.
It's lovely.
It feels really good.
And then you can do the same thing here. You push and pull on the occiput. And I'm just going to glide back and forth. Work around your earring a little bit, no worries. But push, pull, stretch. Nice. Good. And that will really help with a lot of this pressure that sits right there on you. Okay? I'll show you how to do that next session a little bit more in detail, okay?
Sounds good.
Let's focus on your neck. So gentle release here, loose, easy here. Good, let your head fall. Beautiful. Alexa, play Al Green Radio on Spotify. I like them 5, but they're just a little bit of play on radio, you know what I'm saying? Rest. Nice. There we go. Okay, I'm gonna bring the table up, okay?
Okay.
How was all that?
Good. Yeah.
Yes, sir.
Definitely felt good laying on my neck and relieving like
Awesome.
yeah.
Nice. We'll do this. We'll go 180 style. So just stand up for me when you're ready, and then I'm gonna open this up. You're gonna turn around. There you go. Lean on in and relax a little bit, okay? So after I work on her upper back a little bit here, okay? I believe. Oh, you followed that. That's so kind of you. Dr. Angie will probably do some dry needling here. You can meet Dr. Angie or our preceptor, student chiropractor Kendra, who's on the team, who was originally an assistant here. I don't know if you'll remember her. All right, let's work that out, yeah?
Yeah, sounds good.
Breathe only. Easy exhale, let it go. Good job. And we'll get releases just on pressure like that. We're doing a great job letting go. Awesome. Alright, easy. Release tension just in your mid back here. Good. And then just a tiny release up top. There it is. Good. Awesome. Take your left arm and drop it for me. Nice. Take your elbow to the ceiling, just like this. And then drop it. Work out the rhomboid trigger point she's got back there that she was telling me about. Cool. Let it drop. Alexa, volume up 1. Level up. Good, and drop it, let it fall.
I didn't even know you could reach that. It feels so good.
I feel ya. It's like I didn't know that could even get worked on.
Yeah.
Drop down. Said the truth. Oh, good, I'm here for it. Good, back up. So I'm shortening the muscle, pinning the muscle, dropping the muscle. I'm taking pressure and sliding, and this feels really nice when I get to that on her. And then I just hang out until she gives up a little bit in that shoulder, like let it go. There, nice job, you feel the difference?
Yeah.
And then you just start to let go, and I just lean into it. 60 to 90 seconds of compression, especially when I can incorporate active range of motion. So your techniques from Stecco. There you got it. No, just last one. This is enough work on this area. It'll feel better. Easy. Okay. All right, little TLC on the right side, so it's not jealous. It's not a little bounce.
Sounds good.
Awesome. Okay. So, in the beginning, this is our manual therapy. I'm focusing on her primary complaints coming in. We'll get to some secondary complaints along the road, and I'll listen. She says jump. I'm like, how high? No, I'm just kidding. No, for real, we're gonna help you out. Looking forward to it.
Thanks.
You're welcome. Yeah, we'll do some dry needling. You'll see that if you're okay with it.
Yeah.
And I'll ask her again when the camera's off, so it's not like you're okay with it. It'll be awkward. And then we'll maybe do some brief video shoots of some stretches and exercises that we do here. But I hope you got something out of that. I hope you, if you have any questions, you can throw them below, and I'll get back to you guys. And thank you, Carly, for making it happen. Appreciate you. Cool.
This is the treatment for Rachel's neck and upper back pain that we're dealing with. We're going to get more of the focus around into that shoulder blade, but we're going to start up top where those muscles kind of come up and attach. We have our levator scap muscle that kind of starts at the spine of the scapula, twists on itself, and comes all the way up to the, almost to the suboccipitals, but to that upper third of the spine. So we're getting into the muscles along the side of the vertebrae as well as into the upper traps. Good. There's a little twitch. We love that. Don't mind me serenading you while I do the needles.
I like it.
Little Billy Joel. It's lovely. All right. We're gonna hang out here for 10 minutes, okay?
Sounds good.